Wakey, wakey, vukani, vukani, Phelophepa, rise and shine. The people of rural South Africa await you. Rise and shine. It is now exactly 6 o'clock. It's exactly 6 o'clock. I'm sure you are awake. And if you are still asleep, shame on you. Shame on you.
For the past 13 years, Dr. Lilian Cingo has devoted her life to the rural people of South Africa. Lillian managed Transnet's Phelophepa Health Train, a train that travels across the country, stopping in rural areas a week at a time to bring primary health to the poor. Her devotion to rural patients and her staff made her a motherly figure, someone who inspired those around her to sacrifice for others. Under her guidance, the Phelophepa became known as South Africa's miracle train, a train of hope that meets the basic healthcare needs of the very poor.
The South African Medical Association Merit Awards acknowledge service excellence in the promotion of the art and science of medicine and the medical profession as a whole, often through a body of work that spans a lifetime. These awards recognize 3 outstanding medical practitioners for the year 2008. They are Dr. Lilian Cingo.
As nursing sister, Dr. Lilian Cingo had been honored in many ways for the sacrifices she has made and the vital role she has played in giving healthcare to people both here and abroad.
A big hand for the winners tonight.
Her numerous qualifications include a postgraduate degree in neurosurgical disciplines and a master's in counseling psychology. She was twice nominated as Nurse of the Year in London in the 1970s and was presented to Queen Elizabeth as the best neurosurgical nurse in London in 1975. On top of it all, Ma Lillian, as her colleagues call her, has also received 4 honorary doctorates from 2 universities in South Africa, 1 in the UK and 1 in the United States. Lillian, however, seems almost embarrassed by all the accolades.
I feel very honored about the doctorate, but I also feel very humbled by it because I don't think it's anything I really deserve. And I know of many people who I know deserve these things. But I also know that it has been through the help of other people for me to have achieved these doctorates. So I always want to say, let's just give doctorates to all these people I know have helped me. But then, of course, you can't. But I never think it's a thing of my own. I think it's my family, my parents, my grandparents, my son, family, my sister, my brother, because they've been all behind. I've got a loving, caring family that has just supported me.
The support from a caring family dates back many years to Lillian's childhood memories of her parents and the rural village in the Eastern Cape in which she was born.
My father used to have cattle like this, and so we used to go to the fields and sometimes use the plow with the people who were plowing, and after the fields had been plowed that belonged to my father, then other people used to be given the cattle to go to their fields and plow. So rural communities have got a certain strength. You need strength to be in a rural community or live in a rural area, because even the nature itself sometimes seems to turn against you. When you don't need rain, there's rain, then there's drought, then there's too much rain, then there's no rain, then there's wind, and some of the houses used to be blown away by the wind.
It was here in the rural community that the young Lillian learnt about sacrifice and giving. Though both her parents were qualified teachers, her mother sacrificed her career to raise a family. Yet she soon became known as the local teacher, social worker and nurse because of her deep involvement in the community. And without her realizing it at the time, her mother's concern for the less fortunate was directly instrumental in Lillian's wanting to become a nurse.
sometimes I think this is what stayed in my mind, even though at the time I didn't realize it was in my mind. Sometimes she would come back with some of the very, very ill people, say maybe 2 ladies and 2 children, to say they're very ill and the temperatures were high and they need to be seen by a doctor. So she would say, I brought them home so that in the next 2 days we can take them to the doctor, because the doctor is arriving at this hardware shop or a station at 2 p.m. on this particular day.
But often the doctor didn't arrive and the family had to tend to the sick. Such was Lillian's grounding in caring for the sick and infirm. If Lillian's mother played a role in her wanting to be a nurse, Professor Robert Lipschitz, the neurosurgeon at the then Baragwanath Hospital, responsible for separating the Siamese twins Mpho and Mpoyana in 1988, was the person who introduced the young nurse Lillian to neurosurgery in the 60s. And after all these years, the mere mention of his name still tugs at her heartstrings.
You should have told me you know this man. He was always larger than life, but I think that he was that sort of man who saw into the next 50 years, 100 years, 200 years for everybody. And in as far as he was concerned, everybody needed to have a chance. I first admired him, the role he played with paraplegics in Baragwanath, because there were a lot of young men who had been stabbed and couldn't walk, and he encouraged them to exercise. He raised funds for them to go and compete. He made sure that they understood that there was still a future and that maybe they could turn on a new leaf. And that man was just something out of this world.
Professor Lipschitz first noticed Lillian as a young nurse in the children's ward. She seemed always to be with and care for the critically ill and comatose children. He wanted her to work with him in neurosurgery and managed to convince the matron accordingly.
And really, to tell you the honest fact, I was scared of neurosurgery and the central nervous system as a subject. But in those days, you couldn't say no to matron, you just went. If matron said, do this, you did it. So the following day, I went to neurosurgery. And by the end of the day, I thought, this is my niche. I just loved it. I just loved it.
But that was in the 60s, at the height of apartheid, a time when there were no opportunities for young, talented black women like Lillian to further their studies or advance their careers.
He called me and he said, I've been watching you for a long time. You need to be a specialist in neurosurgery, and I realize that you're black and you can't be trained in South Africa in this specialty, so you have to go to England and be trained in neurosurgery. And I said, well, I don't even know actually any neurosurgical place there. He said, but don't give up, don't give up. I'm not going to do it for you, you're going to do it. And I said, have you got the names of the hospitals? And he said, I want you to go to this special hospital. It's the best in the world, and that is the National Hospital for Neurosurgery. And that's where I went.
When the young and vulnerable Lillian left the country of her forefathers to further her studies in London, she didn't realize it would be 30 years before her country would accept her back as a citizen and daughter of its soil. In London, she had met and married an exile who fathered her only child, Jameson Hlongwane. The couple later separated and divorced. Lillian went on to study tropical diseases and also obtained her master's degree in counseling psychology while raising her son as a single parent.
Mum worked very, very hard. I mean, she worked hard to be a mother as much as she could, and she tried very, very hard and was very good at that. I hope I'm the product of that. And then, in addition, from a kind of like work perspective, she was a nurse, and she was, in fact, she was a sister. She was a kind of like head of a ward, which is a neurological ward, and I remember going to the ward quite a lot, what I just remember was that she was dedicated. Also, she had a funny knack of just knowing what to say, how to treat somebody well, and how to sometimes keep somebody alive. if I'm not wrong, I don't know what it was, but at some time the Queen did pass on an honour to her. So I don't know which one it is, but I do know it did happen. I probably should know, but I don't.
While having been presented to Queen Elizabeth as the best neurosurgical nurse in London, Lillian's own country turned its back on her, denying her citizenship and a passport.
There is nothing as awful as being stateless. The day I went to South Africa House and I said, you know, what is happening? They said, oh, well, you cannot get the passport for South Africa. I was traumatized. I really was, because I thought, I can't believe this. I'm South African. My great-grandfather was, and now I'm stateless. And I stood there around St. Martin's in the Fields and South Africa House, and I know how it feels like when you want to throw a bomb at a place. I know it, because if I had a bomb that day, I could have thrown it to South Africa. I was so angry that being a South African, being really a South African, I couldn't get a South African passport.
You know, I mean, even though, you know, I suppose I was in London for 27 years and born there, and Mum was there for 30 years or whatever it is. Doesn't mean that any of us didn't see ourselves as South African. You know, and it's disheartening when you're saying you're South African, when deep down in your gut, you know that there are officials in South Africa who don't consider you to be South African or don't want you to be South African.
Well, I think that most of the things that happen in our lives, somehow there is an upper hand that guides what happens in our lives. There's the unseen hand, the unseen highest that guides and directs. Because whatever I did in London has been very, very useful in the job I do on the train. And I always think to myself, there was a reason I had to leave South Africa. There was a reason I had to be in London for all those years, because whatever I learned, I was able to bring and use for rural communities in South Africa.
In the early 90s, there had been many changes in South Africa, and in 1994, after 30 years of rejection, Lillian was finally able to reclaim her citizenship and return to a liberated and free country. Having heard of the Phelophepa South Africa's healthcare train that served marginalised communities, she eagerly applied for the job as manager on the train. Dr. Lynette Coetzee, who is the project manager of Transnet's flagship program, didn't hesitate to appoint Lillian.
Phelophepa started in January 1994, and I did not have a manager on the train. I didn't know who I need to come and help me on the train. I was looking for a matron, but a matron with a heart, and I couldn't find a matron with a heart. So while I was looking, Lil was on her way back from England, and somehow she heard about this job. Now, can you imagine, when she walked into my office, I saw the angel I was looking for. I didn't care. I didn't even want to interview other people. It was a love affair from the beginning. And Lil couldn't understand rand and cent. And we just did a contract in pounds. I convinced her. I didn't tell her she will have to do a technical course, you know, to work on the engines, etc., because I was scared that maybe my angel wouldn't like the job any longer. So once she was appointed, I told her, Lil, you will have to go and do this technical course, but it was a love affair, and what a wonderful, wonderful experience.
But why would someone who had dined with the Queen and was friends with Princess Diana want to spend her life in the confines of a train that travelled deep into the heart of rural South Africa? To Lillian, it was a calling. The sophistication and ease of life in London had not erased her memories of her childhood and the suffering of her people.
Even when I was overseas in London, I used to think, my God, where I grew up, there were days when the doctor wouldn't come because it was raining, or the doctor was busy, or because it was muddy, or the roads were too bad. But what upset me most was that having had a child born in Britain, I used to bring my son, not to Soweto where my parents later went to live, but I wanted him to know also about rural areas. So I used to take him down to rural areas. And my sadness was finding that things were still not so good for rural people. And I thought to myself, one day I must come back and play my role and just make it a bit better for rural communities in whatever way you want me to do it, God, please. For me, it was absolutely essential and crucial to do this. And it wasn't so much for rural communities. Yes, it was for them, but it was for me. I felt that I could never actually be at peace with myself if I didn't do this. Phelophepa team, it's time to rise. Vukani, Vukani Phelophepa, wakey, wakey, where more opstan. In Soto, so hang. Vukani Phelophepa team. What can you do but get out of bed? Remember, you're here to serve the rural communities of South Africa. And service is the price we pay for the privilege of being in this world. Wakey, wakey, Vukani Phelophepa, rise and shine. The people of rural South Africa await you.
There's no way one can stay in bed when Ma Lillian calls you to service.
The way she says it, that the community is waiting, and shame on you, obviously, if you're still sleeping, shame on you. And actually that is very inspiring because you as a person, you know that the community is out there, they need us, but we don't do much. But she dedicated her life to it, so it's really inspiring.
Many of the students come from backgrounds, wealthy backgrounds, city backgrounds, backgrounds that really have no contact whatsoever with the rural communities that we're dealing with here on the train. And many of them had no idea that people had to live under these conditions that they do, that we see very clearly on Phelophepa.
Hi Martha, you want some chips?
37 students from various universities join the train every 2 weeks to assist in the health, dental, eye and psychology clinics. They work from early in the morning to often 9 o'clock at night. It's part of their training, but also a life experience, an opportunity to grow as human beings.
Somehow we give dignity to people who probably haven't had that sort of treatment before. And that's what we tell students too. When we talk to students, when I talk to students, I say, you know, yes, you have come to help rural communities, but also this is a challenge for you. What are you going to do about these rural people? You are from urban areas, middle-class families, some of you. You've never shared in your rooms, you're going to share now with others.
For us girls staying here, I mean in the same room, squashed, you know, we're learning to cope with each other, difficult as it is, but we're learning, you know, it's not easy, but we're learning.
And what I basically took from all this is I'm not promising to be humble, but I'm going to try my utmost best to be humble and to be loving, more kindness, more joy in my life, and to remember that it's not all about material things. There's more to life than cars and money.
I hope that whatever I said or whatever I did has made an impression on my students and on the staff members. I've dealt with so many young ones over the last 13 years. I love my students. I love youth. I love young people. I think, my God, the world is your oyster. What are you going to be? And I just imagine them being this and that stimulates me and inspires me. So I hope I've inspired them. I hope they've learned from me. I hope that by my actions, by what I've said to them, they will aspire to higher levels. I hope so.
Zander Fleming, who today heads the psychology department, remembers well how inspired he felt as one of Lillian's students.
From the orientation, the first evening, right through the whole 2-week period, Everything she did and she said was just an inspiration, and it really touched my heart. And yeah, I just fell in love with the project. And before I left on the bus the last Friday, I told her, Ma Lillian, you'll see me again as one of your permanent staff members in a few years.
Dumelang, how is it? Yeah, thank you for coming, Ben. We are pleased that members of the community are here to help. This is your train.
Besides training students and treating patients, the Phelophepa also provides temporary work to 120 casual workers per week. This is carefully planned between Lillian and the local coordinator.
What time? You are perfect, perfect, perfect. Well done, well done.
Lillian's next task is to orientate and motivate the community workers. She tirelessly addresses group after group. First, the cleaners.
But the most important thing is make sure that you learn. This train is about teamwork. This train is about working together. This train is about sharing. This train is about caring. We will care for you, and in your jobs, you will also be caring for us.
She is a good teacher. Lillian, when she is orientating the translators, she educates them. She does not educate them only for the train. She educates them about the future prospects of employment, the importance of punctuality.
There is no African time on this train. And talking about African time, we cannot afford to have African time. If you are late, you are giving a message. You are saying, I'm not a reliable person. You have written your own reference. Sevan. So in life, check yourself. What reference are you writing about yourself? Do not discuss people's illnesses amongst yourselves in the location, in town. Hey, so-and-so nalimo training. Bari vatane aya. Bari penis ya gagwe ibodile. You know all these things. Bari wakula. Hey muto bari washa. Hey, do not do that. So you are also here to bring respect and dignity to your community. So that when people leave the train, they say, hey, I went to that train. Hey, I was treated with such love and respect. I felt good. Make people feel good. And when you make people feel good, you also feel good.
She actually prints it in everyone's mind, respect, and you treat people with dignity. Because after all, to gain respect, you've got to give respect. And that is one of the most important aspects that Lillian has brought to this train.
Working with Lillian for 11 years has taught me the spirit of Ubuntu, practicing goodness in people and also seeing goodness in people, trusting people. She is a mother to everybody on the train. She is a mother to the rural communities of South Africa, because she is the one who motivates us to take more patients even if we see that we are going to sleep at 9 p.m. But the way she motivates the staff, the students, and the other workers on the train, you can't help but taking more and more.
To follow Lillian around as she goes through her daily routine is no easy task. Yet seeing how she relates to her co-workers in the community, one soon understands why Dr. Cingo has become known as Ma Lillian.
Yeah, when the exercise and just sit there, utengis. So ngiyazi ukuthi nifuna ukubona, ngiyazi ukuthi kudala nifikile la. Manje laba bazonihlalisa kakhulu. Ningani ningasuki nime ngenyawo ningekatshela ukuthi nime ngenyawo ngoba
Andries Makoko, the external logistics supervisor, has worked with Lillian for 11 years.
Dr. Lillian. I get even Karen because Dr. Lillian also a manager mo training. Ki what training na? Ki ena o ha o na le bothata ka pa o gona ga dule fatshe le wena. I know. Go gona mamela bothata ba. So una le nako ya motho o mo le o mo training mona.
So you remember that we stayed in the train for 9 months. We really spent a short time at home with our parents and all those things. So while you're in the train, you need someone to talk to sometimes. And if you talk to her, it's like, well, I've been speaking with my mom, you know. She's so disciplined, and she doesn't have to discipline you. You just need to copy it from her, and then how she behaves, how she lives, how she talks to people, her approaching to people and her approaching to things. You just look into it and you learn from that level, you know, that okay, this is how people need to behave, this is how people need to live, like, you know, those kind of stuff. She's got all the qualities of living in this world.
Maybe through her experience in life, she's become an excellent manager, and her approach to people is always respectful and honoring. That way, she has this amazing ability to maintain harmony. She's actually someone I'll call a peacemaker.
This woman is marvelous. God has given us so much to give to us. She always encourages us, and we're here to serve the rural people of South Africa. We're here to give. We're here to share. We're here to give them love. And only when we as South Africans can work together like this woman, Dr. Cingo, we can make this country, South Africa, a better place.
The way in which the community of Bushbuck Ridge celebrated the train's arrival in Acorn Hook is a powerful testimony to the way in which Lillian and the Phelophepa staff have already made South Africa a better place.
The management of this train, they do care much about the lives of our communities. Just imagine from January to September, being far from your family, but taking care of people's life. It means that you are just like semi-God, you know, because you take care of people's life.
So as they say, we respect them and care for them and honor them, the more I feel we should care for them and honor them, because they deserve it more than we do. They deserve it more than we do.
She cares about rural area because she grew up in the areas where there is nothing. Now she really cares about rural area kids, and especially the kids. She's so passionate about farm area because she knows how they live. They've got nothing.
For the past 8 years, Cecilia has been part of the Phelophepa Outreach Program, which takes healthcare from the train to the community, where she and her colleagues visit schools to assess and educate children.
Some areas you get touched when you hear that a child can't even afford a toothbrush, and especially in farm areas where there are no shops, nothing. Most of the learners will tell you that this is the first time I'm having a toothbrush, because at home there is one, but it's only for my mom or for my dad, or we've got one for the whole family.
Sometimes I look at some of the people and think, I don't know how you can smile. Life has not been very kind to you. And here you are, smiling, hopeful. And that's what gives me hope also.
We still always get the train. Ma'am, we still love you. You did a lot with us. Yeah. You brought us, look now where we are today. I'm working in HPSSC, Social Services.
Are you?
Yes, ma'am.
Congratulations.
I brought clients here, they want to extract teeth. so I still have a lot of people there at home that I must bring here.
You must bring
Before you move here, I promise you to give about 20 people who just
They must come very early, ne?
Yes.
And please bring them before Friday, because Friday is the last day.
I've got 3 here. Then my father and my mother also must just come here tomorrow.
Okay. Are they coming for eyes?
No, for teeth and eyes. Everything is
we have improved our eyes. Our frames are brilliant.
That's good.
So good to see you. Ne? Okay, bring the patients.
Okay, good.
Initially, when I started, the frames were round. And you know what? Rural communities are a lesson for us all. I love them. I respect them. They are humble, but they are wise. They've got a depth. They've got a generosity of spirit that we don't have. And they appreciated even those round frames, because for them, they just wanted to see and nothing else. For the children at school, they just wanted to see. They just wanted to work. They just wanted to read their Bibles. But now, you've seen we've got equipment where we cut the lenses so that the spectacles are fashionable.
So with this train, we feel very much honored. This is one of the poorest community at Ekenu. They don't have enough money to pay to the clinic. They don't have enough money to pay for the transport from here to Mkutlu Matikwane Hospital, to Mapulaning Hospital. Those places are very far. But with the train, it's here since from Monday. Then some of them, even if they are not well, they are ill, they can able to work, to walk using their own foot to come to this train. The train is just like a river which is flowing just next at the door of your house.
Ritlemona go tlo thusa marine ke boletse ka Sontaga gore train ena ya tsamaya. Ha train e tsamaya re gone go bereka teka re tla re bereka. We cannot see you all today. Asina kunibona nonke namuhla. I-train iyahamba, bengishilo ukuthi i-train iyahamba. So mina esamjena already, I'm just saying sorry, apologies. We know your need, but we cannot do anything about it at the moment. We have done our best.
All too soon, a week has gone past. It's Friday, and the train must move on. And though countless people have been helped, there are many people for whom the river has just run dry.
You know, when the train has to leave, and I think of the people we sent away, then the certificates and the awards and all these things are not important. But for me, I think the worst thing is knowing that some of them are not going to be able to come back. That was the money borrowed, that the distances are too far, that it's going to be impossible for them. And that the train will probably come back in 2 years' time and they still won't be able to come, or they will have died, or they will have been blinder than they were. That sort of thing really stays with me and it haunts me. I can never be at peace with that, because it should not happen. It should not happen. Even if you come at 5 o'clock or 6 o'clock, would depend on Baba Kai Battling Pilhoen. Akiri Babang by Robesi Mona Babang. So you came early, others come before you. You know, I'm sorry. I'm sorry. As people have been disappointed all these so many years, the disappointment becomes a death as the disappointment continues. So now, what do you want me to do? What is your advice to me? So death is in many forms. And you don't want that to happen to people. You want that hope to continue. And when their eyes are flickering and they've got hope, then I think, yeah, that's the way it should be.
And indeed, in the 13 years as manager on the Phelophepa, Lillian has shared far more joy with her patients and staff than sorrow. For example, the train's jewellery shop.
What jewellery shop?
Jewellery shop.
There's no train's jewellery shop. I just love jewellery. So anyway, I took all these very important people down to the end of the train, all 16 coaches of it. And then as I said goodbye and they thanked me, one of them said, oh, I just want to go to the jewellery shop, to the jewellery place. I said, I was so taken aback. I said, jewellery place? He said, you know, where they sell jewellery, where there's a lot of jewellery. We passed the place here where there was a lot of jewellery. I said, no, it's not for sale. That's my jewellery.
Lillian's penchant for jewellery is just one of the things she will be remembered for after she has left the Phelophepa. By the time this documentary is screened, Ma Lillian would have retired.
And it's also the last meeting that I'm going to be with you on this train for me.
No one is glad to see her leave. Yet everyone understands that Lillian, who has given 13 years of her life to the rural communities of South Africa, deserves some time to take care of her personal affairs and needs, like spending some time with her grandchildren and just being gogo for a while.
My son got married to this wonderful girl, Pindi. She was Pindi Mkukuta, she's Pindi Hlongane now. And she's given me 2 gorgeous, gorgeous grandchildren. I love them. And when I come from the train, they wait, and then they see the vehicle, say, go, 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 go. And I just feel so loved, so content. And in fact, it's a wonderful feeling after the train because it lifts me up. And I thank God for them. So, you know, I'm just feeling so blessed, so blessed. Leaving the train after 13 years is an emotional thing for me. So I don't want to talk a lot about it, but it's also a decision that I have made because I also need to get away from the train. I need also to get some sanity back in my life. I need to sort a few things of my personal life because being on the train for 9 months every year, you can't do certain things.
Sister Maggie, who like Lillian grew up in a rural village, has worked on the train for 11 years. Her personal experience and expertise as a nurse makes her a logical successor to Ma Lillian.
We have talked about this and I've told her that, Lillian, I don't understand why you are leaving because you are still fresh. You can still work for another 5 years. And then she will always tell me that, I know you are beginning now to panic and I'm not going to tolerate that. You can do it. So really, and during those times, I'm usually in a panic state, wondering if I'll be able to make it. And then she'll say, you can make it. You are going to make it.
She's younger. She's got new ideas. Let's use her ideas. She will take, she has already taken perhaps what she liked from me. She'll throw away what she doesn't like, and that's okay. That's okay, that's progress.
Lillian may be leaving the train, but she's not leaving a vacuum behind. The contribution she has made to people's lives is a legacy that will live on beyond tomorrow.
As long as you're first come, first serve. That's all I want. First come, first serve.
For me as a young person, you come from university, you're passionate, you think everything, the world must make a way for you. But what I've learned from her, it's in terms of when, you know, to say the right thing, to take the right decisions, and how you handle yourself, especially as a young person and being the clinic manager. And I think that is something that's an invaluable contribution that she's made in my life.
When I think about Lillian, I see this woman with the passion, the commitment, the caring, the beautiful brown eyes, her laughter, her sense for humor, how she taught students to just give their best. She taught me why sometimes I cannot look at financial implications only, because I'm the heart financial manager and I need to manage the budget. And very often Lillian would have said to me, Lynette, I'm not going to argue this. I don't want to talk to you. And I would say, fine, I don't want to talk to you either, because we could argue, but always for the better. What a wonderful, wonderful experience. And I think in my life, I will never ever have a friend like Lillian. Lillian left us a legacy of respect.
We appreciate your getting up at 4 o'clock. We appreciate the fact that you don't go to bed until late, preparing. What could we all do without all of you? Thank you. But the most important thing is the smile. I know you frown sometimes, but the smile makes a big difference. And I know that sometimes we have stressed you, but somehow you manage to give a little smile and continue that, because it is so important.
I feel that she's taught a lot of people that she's worked with, you know, that sacrifice is worthy and that you do get something out of it. It's not just, you know, that you end up, you know, sort of disheveled and bitter and twisted. You know, she's a very happy woman and she's sacrificed most of her life to other people.
I look at this and I say, 13 years in this little tiny thing. You see, I can't stretch my hands. You see, I can't stretch my hands like this. I can't. And you know, I can't open this wardrobe. I can't open this door without pushing myself in like that. 13 years, but for rural communities, I could do another 10. 13 years, for rural communities, I could come for another 4 or 5, I'm sure. Anyway, I'm going to miss this room. I'm not going to miss the room. I'm going to miss the patients. I'm going to miss the work that is being done here. I look forward to having a bigger bed. It's not been easy sleeping on a small bed like that. You know, when you turn, every night you have got to wake up and tell yourself you're turning. Otherwise, you fall out of bed.
And so, at the end of September 2008, when the last patients had been seen to, the tents dismantled and the staff and students were leaving, Lillian considered her life.
I've been a very, very lucky woman in so many ways. I've walked with kings, with princesses. I've done it all. But for me, it was always the rural communities. For me, the rural communities are the kings, are the queens. And that's why on this train, I want everybody to feel important, to feel loved, to feel valued, to be a human being with dignity. As long as the rural people are still struggling and suffering, none of us can afford to go to sleep. There shall be no slumber.
I want to thank Dr. Cingo very much for the wonderful service she brought in our community. Get enough rest at home. You know that when you rest, you can recover. Sometimes we will see you again. But when we saw the train coming to the station, we start remembering Lilian Cingo. Thank you very much.
Thank you very much. Good luck. Good luck in the future. Thank you very much. Thank you. Thank you. Girl, we've got a beautiful voice. Thank you very much. Thank you. Thank you very much. Max, thank you very much for organizing it. Thank you, thank you. She's going to be the manager, you know that? Yes. Yes. I don't know if I'm even going to rest in London, just thinking of the need in South Africa. I don't know. Because I spend sleepless nights thinking about South Africa and its challenges and problems. I know when I go to London, it's not going to get out of my mind. So how can I settle? I can't. I'm going to come back. I know God will give me another direction, another thing to do, but it still has to connect with South Africa, with Africa.
Dr. Cingo, ufamba kahle Cingo, itayitsunzuka mitiro ya wena. Dr. Cingo, ufamba kahle Cingo, itayitsunzuka mitiro ya wena. Dr. Cingo, ufamba kahle Cingo, itayitsunzuka mitiro ya wena. Ibona sitimela, itayitsunzuka mitiro ya wena. Itayitsunzuka mitiro ya wena. Ibona sitimela, itayitsunzuka mitiro ya wena.